Hi everyone, welcome to today's webinar. This is Heidi Notario. I'm the Vice President of Strategic Partnerships and Systems Change with the National Resource Center on Domestic Violence. Today is the first in a series of coordinated entry resources and approaches that we're very pleased to present to you as part of the Domestic Violence and Housing Technical Assistance Consortium. I'm joined today by Drs. Cris Sullivan and Gabriela López-Zerón from the Research Consortium on Gender-Based Violence at Michigan State University, and my colleague Kathy Moore from NRCDV and Brittany Eldringham, who will be supporting the technology pieces of this presentation today. Before we get started, I would like to go over a few housekeeping items. The first thing is that there is a link in the chat for those of you that would like to follow the caption of today's webinar, and that appears on the chat. That's typically on the right-hand side, and you access that if you click on the bubble that's at the bottom of your screen that reads chat. This webinar is going to be recorded, and we will share the recording and the presentation materials with all of you following this webinar. Also a reminder that if you haven't done this already, to please sign up for our newsletter, and how to do that will be part of our follow-up materials. With that, I am going to get started then with the presentation. As I mentioned before, the Domestic Violence and Housing Technical Assistance Consortium, DVH-TAC, is a collaboration, is a partnership among the Family Violence Prevention and Services programs from the Office of Health and Human Services, the Office on Violence Against Women from DOJ, the Office for Victims of Crime, the Office of Special Needs Assistance Programs from HUD, and the U.S. Interagency Council on Homelessness, and also through a great collaboration by technical assistance providers, and that includes the National Alliance for Safe Housing, Collaborative Solutions, the National Network to End Domestic Violence, the National Resource Center on Domestic Violence, the National Sexual Violence Resource Center, and the Corporation for Supportive Housing. As part of the commitment of the consortium to racial equity and centering Black lives and Black survivors, we want to share this infographic, this animated infographic with all of you that highlights the overrepresentation of Black, Indigenous, and other people of color in the homelessness space.
Homelessness is an issue that far too many people face. People of color, specifically Black people, other persons of color, and Indigenous people, experience homelessness in a dramatically different way than their white counterparts. People who hold multiple identities, such as those who live at the intersections of disability, immigration status, sexual orientation, gender identity, and more, experience compounded barriers that further homelessness and housing instability. A recent study found that 66% of people experiencing homelessness were Black, while 28% were white. Black individuals are only 13% of the US general population, compared to 74% of those who are white. Rates of homelessness within Native communities are 3 to 8 times higher than that of the general population. In total, 78% of people experiencing homelessness identified as people of color. This overrepresentation of Indigenous, Black, and other people of color experiencing homelessness cannot be explained by poverty or identity alone. Structural racism, historical policies, institutional practices, and cultural narratives that perpetuate racial inequity put people of color at a disadvantage in obtaining safe and affordable housing. Statistically, women of color are much more likely to experience domestic and sexual violence, and survivors often face network impoverishment. Network impoverishment occurs when the addition of a financially distressed household member places an extra strain on family resources. Oftentimes, we tell a survivor experiencing homelessness to go to a relative or friend's house. However, network impoverishment can cause immense burdens on the existing limited finances and available support from that network. Racial disparities arise at every juncture, from the legal system to housing to healthcare to child welfare to public benefits. Understanding the intersections between domestic and sexual violence, racism, and homelessness, and applying an equity, survivor-centered lens in our work is the only pathway to stability, safe housing, and healing for all survivors. If we want to address racial inequity, we have to acknowledge it, learn about it, and talk about it so we can do more about it together. To learn more, visit safehousingpartnerships.org.
Thanks, Brittany. After bringing some of the context and part of the reason why we're inviting all of you to make this shift around coordinated entry and assessing priorities, particularly in the context of survivors of domestic and sexual violence, I wanted to go over some of the other reasons why we're putting out this invitation and why the purpose of this series of coordinated entry papers that we're about to introduce, starting with this one today. I also wanted to highlight that early this month, HUD presented a guidance that explicitly named disparities experienced by Black, Indigenous, people of color, and LGBTQ populations. And in that guidance highlighted their intended goal of ensuring that the most vulnerable are prioritized. We also know that there is a unique convergence and disparate impact of numerous public health crises. We're talking now, some people refer to this as a double pandemic, although none of these things are new. In addition to COVID-19, we're seeing many manifestations of systemic racism, but we also, for those of us that work in the anti-violence movement, we also know that in this context that we're living, there is an increase in domestic and sexual violence, and all compounded by poverty and homelessness. We know that some of the present ways of assessing priorities when it comes to survivors really exacerbate inequities and place survivors in particular in difficult situations, as they tend not to score as they should to secure housing. And connected to that, we know that many communities are dissatisfied with the VI-SPDAT, which is a tool that the original intent wasn't to become what it did, but is widely utilized. And we are hearing of many communities asking for a new alternative, and many are trying something different. So we are at a critical time where a bold move towards increasing equity for all is necessary. Is an imperative, and is something that we, for those of us committed to ending violence in our communities, is something that we have to do. So with that, I am going to turn it over to our presenters, and Cris, welcome, and Gabby.
Thank you very much, Heidi and Kathy and Jenny and Brittany, for making this possible, for inviting us to have a conversation with people about this really important topic. And so we are looking forward to making sure that we leave time for questions and conversation. It's been exciting to see who's on this webinar, people from all over the country. So before we get started, I did just want to have the acknowledgement and disclaimer slide on here. This wouldn't be possible without incredible support from the Administration on Children, Youth, and Families, Family and Youth Services Bureau, So we really appreciate them funding this effort, but obviously everything you hear today is the responsibility and views of myself and Dr. Gabby López-Zerón, and not necessarily the funders. So I want to start by talking about why this is an important issue and what we're trying to accomplish. Basically, as Heidi started to talk about, HUD requires that COCs utilize this coordinated entry system. Probably most of you are aware of that, which is why you're on this call. And the point of that is to have one system in place that ideally is fair, that will prioritize homeless people into what we all know are very limited housing options. So the system was intended to make sure that people have equal access to housing and fair access to housing, because we don't want people to be experiencing prejudice. So the idea is that we would prioritize those in most need and the most vulnerable individuals and families into these limited options. Now, it's hard to argue with that. That's a laudable goal. The idea is fantastic. We want to minimize favoritism and prejudice and making decisions that are not equitable. But as we all know, it's a lot more difficult than it sounds. And people have been working very hard at this. And I just really think that the most of the people really trying to figure this out have good hearts. They want to get it right. They're really trying to make sure that this works well. And we are still to this day struggling with this. So we're hoping that this at least moves some of our thinking forward, or at the very least gets us all talking a little bit more about next steps. So the most frequently used screening tool within these coordinated entry systems is the VI-SPDAT, or one of its iterations. And that's primarily because it was the tool that was out there. Some people think that HUD recommended this tool or even mandated this tool. They did not. They never mandated that people use the VI-SPDAT, but some people do believe that they did. They just said that you had to have something, and most people had nothing else. And so this VI-SPDAT has spread like wildfire as the tool that people are using. And it's very problematic. So we could do an entire webinar on why the VI-SPDAT is problematic, and we don't have time for that today. One of the papers in this series is specifically on the problems with the VI-SPDAT, and so you can hear more about that, I think, at the end of this webinar. But I'm just going to go through some of the real basic major problems with it. This is not an exhaustive list. There are serious issues with the VI-SPDAT. The first is it was really created to assess the vulnerabilities of chronically homeless individuals, and I do mean individuals, not families, who are experiencing severe mental illness and substance abuse. So it was really set up for the chronically homeless and was not intended originally to prioritize domestic violence survivors or many other groups of homeless individuals for that matter. And even as they have modified this tool over time, it continues to be very, very problematic. And certainly it is not trauma informed in the types of questions it asks and how it's asked them. More recently, an empirical study has now found that this tool lacks validity and reliability. So in short, it doesn't give us what we're looking for. You can't trust it. And again, I won't get into a lot of detail about that, but it does lack validity. It's not a great tool for doing this. And probably the most important to at least many of us is that now we realize that it has resulted in racial bias in prioritization. So as more and more people are using this tool around the country, you're hearing more and more critiques. And I have yet to meet too many people who really like the VI-SPDAT. And again, you know, I don't mean any disrespect to the people who created it. Maybe it works well with chronically mentally ill, homeless individuals with substance abuse. And again, we're all learning together, but I do think we have to really think of an alternative to this tool. I get that people want a brief and easy to use scoring tool. Who doesn't want a brief and easy to use scoring tool that's going to help us reliably rank people's vulnerabilities, document their preferences and needs, and help us match them to appropriate housing? That would be fabulous. We all would love to see that. Unfortunately, though, I think those of us who've done this work on the ground, seeing the complexities of this, recognize that these overly simple solutions, while they might sound good, are rarely the answer to complicated problems. So we propose moving away from this scoring system toward having focused conversations that will cover topics that are actually relevant to choosing strategies that will lead to safe and stable housing. I do want to say that about a year ago, probably even more than that, I lose track of time, we did think, let's see if we can come up with a different scoring tool. Let's just come up with a better scoring tool, right? Create a better mousetrap. We had really wanted to do that. A group of us from DVH Tech Consortium had many meetings. We talked about how to create a tool, pilot it. We really went down this road. And what we realized is every time we got together, though, and talked about this, all we talked about is how no scoring tool is ever going to be what we want it to be. And so why would we try to come up with yet another tool when we actually just don't think you can score people? And so that's when we backed up and said, then how do you help people get into housing? We don't want to go back to situations where people just provide housing to the people that they like, or that are likable, or that are grateful, and don't give services to people that they may not like all that much. We're not suggesting we would ever want to go back to that. But we also know that there are questions that we can ask people that will get at the safety and stability concerns that would give us information we need to help prioritize people into housing. So I want to make a couple of caveats here, because I think it's really important that we always remember and talk about, not just amongst ourselves, but to policymakers, funders, that the need for housing far exceeds the supply. One of the problems with any of these tools that we're talking about, any of the problem we have with prioritizing people into housing is that there are not enough housing options. There's not enough affordable permanent housing. There's not enough shelter beds in domestic violence programs. There's not enough domestic violence transitional housing programs. There's not enough flexible funding that we know can help people stay in their homes. So we have to keep fighting for more housing. And that's one of the pet peeves I have about spending a lot of time about prioritizing people into housing when we know there simply isn't enough housing. And people joke, but obviously it's not funny, that what we're doing often is prioritizing people onto wait lists. And that's really painful for the people in the field doing this work, and it's certainly even more painful for the individuals and families who are homeless and unstably housed. So agencies are really having a difficult time then. There aren't enough resources in most communities. There's not an array of resources in most communities. So not everybody has transitional housing anymore in their communities. Not everybody has rapid rehousing. Certainly nobody that I'm aware of has enough permanent affordable housing in their area. So agencies are now faced with this really difficult decision of we have one housing unit that just opened up, or we just got a housing voucher. And yet we have multiple people who are similarly disadvantaged. And whether you know that because you've scored them on the VI-SPDAT, or used some other tool, we know that there are many people who are going to have the same score or who are going to be in the same situation. So we're still dealing with this issue of who then gets this one housing voucher, who then gets this one housing unit. So how to do that even once we've decided who's really vulnerable, who's really disadvantaged, and what option might be best for somebody, we still have more people than there are options. And so then we still have to figure out then who among these people gets it. What we suggest in our paper is we believe the fairest way is first come, first served. It's not ideal, and we may have a conversation about that at the end of this, but I don't know about you, I would have a very hard time deciding which of two people in extremely difficult situations deserved a housing unit more than the other one. Is the teenager who's been sexually assaulted by her father since she was 4 years old and now has PTSD and maybe doesn't speak English more or less in need of that one housing unit than the woman who's been severely and repeatedly beaten by her husband for years and has a child with severe disabilities? This is a really difficult situation that we're all in, trying to really prioritize people. So we really want to talk about moving away from a scoring system and thinking more in terms of a decision tree. So in this paper, and I believe you're going to have a link to it at the end, it's on the VI-SPDAT Consortium website now, which also, if you really liked that amazing animation at the beginning of this webinar, that's also on the VI-SPDAT Consortium website, which is called safehousingpartnerships.org. That's safehousingpartnerships.org. They have amazing resources on there. Anyway, so we have created this decision tree that involves asking very pointed questions of people. So again, we're not going back to, hey, have a conversation and see what comes up. We believe there are 3 really important areas that we can focus on that will help us determine what might be the best housing for each person who's coming for help. Safety, when it comes to victims of violence, is really important to ask about, but not just safety, safety as it relates to housing. I've done a lot of work in this area. I apologize, actually, I should have introduced myself. I'm a professor at Michigan State University who has done work on interventions for domestic violence survivors for a little over 30 years now. We're always trying to understand what works for whom under what circumstance. I'm the senior research advisor for the National Resource Center on Domestic Violence. And I've just been really honored to work with people around the country who are dealing with lots of these really complicated, complex issues. And I continue to learn from the amazing work happening around the country. And one thing I've learned from people who are trying to figure out how to prioritize people into housing is that some of them are using the danger assessment tool, Jackie Campbell's danger assessment tool. And I want to talk for a minute about why that's problematic. The danger assessment tool is a great tool for really understanding lethality and severity of abuse that somebody might be experiencing. It does not tell us what somebody's housing needs are. So asking it as part of an assessment to help somebody figure out housing is not necessarily the best way to go. So for example, if I find out from the danger assessment tool that the abuser has weapons or that the abuser has caused the individual injuries, that doesn't tell me if the person is safe in their home or not, because I don't know where the abuser is. I don't know if there are ways that we might be able to help that individual stay safe in their home. And a lot of times individuals think they have to leave their homes. So they may not even be homeless yet. They may just be fleeing domestic violence, and they call and they reach out because they're unsafe and they think, oh, I have to get into a shelter, there's no option. We need to have conversations around, would you want to stay in your home if we could help you be safe there? What would it take? Where is the abuser now? Do you have family or friends that you might stay with? Where are they? Would that be safe? It may be that somebody's safety is in jeopardy and they need to get into a domestic violence shelter right away. But we have to be thoughtful about asking enough of these questions in a really respectful, thoughtful way that we're really hearing the answers and then following up to those to help us understand, could this person be safe in this situation? Might they be safe in this other situation? So one of our areas in the decision tree that you're going to see is asking about safety, but safety as it relates to someone's housing. We also think it's important to ask people about their more recent housing instability. How stable or unstably housed have they been in the last 6 to 12 months? Somebody who's been homeless and living on the street for over a year is going to need very different resources likely than somebody who has just lost their home because they lost their job and couldn't pay their rent. But they are skilled, they have an educational level that would help them get another job quickly. So these are the kinds of things that would help us determine with the person what options might make sense for them. Rapid rehousing, for example, I know it's different in different communities. It's vastly different in different communities. There are some communities where rapid rehousing allows you to provide rent assistance for someone for up to 18 months. Mostly though, communities are using rapid rehousing to give people housing financial support for only about 3 months or 3 to 6 months. And so in that instance, you could be setting somebody up for failure if you help them get housed and pay their rent for 3 months when they know and you know that there is no way they will be able to support themselves after that 3 months is over or that 6 months is over. So it's asking people questions about their history and what they think they're able to do and why they think that. So when do they think they might be able to pay rent, or how much could they contribute to rent? Are they employed? Is there any way for them to become employed? What's their educational level? What are the kinds of resources they need that will help them eventually pay for their own housing? So those are very pointed questions to ask people so that they are helping make an informed choice about what's going to make sense for them. Also, what are the other issues going on that could prevent them from accessing or maintaining safe and stable housing? Some people are experiencing such severe PTSD that they may need more time. They simply may need time before they're going to be able to live completely on their own. I did a study recently with colleagues on transitional housing and which domestic violence survivors wanted transitional housing versus rapid rehousing or something different. And there were some people, so these were all people in transitional housing that were in this study. And they were asked at the end of the interview, if you had had the option of getting into permanent housing instead of transitional housing, if this program had given you money to be in the community in your own housing versus in this transitional housing program, would you have taken that? And we had quite a few people who said, yes, as long as I would still get these services, I would rather be in my own house. Sort of makes sense, right? That's what we would think that a lot of people would say. There was actually a fairly large population in there who said, no, because I would not be safe in the community. I have to be here while these folks at this transitional housing program are helping make sure that when I do go out into the community, I am safe, because this abusive person is still looking for me, still has friends and family looking for me, or whatever the situation might be. So it's important to have these conversations with people about what's the safety, what's the financial issues going on, but what are the other issues that are important? whether they're mental health issues, whether they're social support issues, whether they're immigration issues, having a criminal record that might make it difficult for them to obtain housing, not having a credit record at all of those things can help the agency member decide with the person what's going to be the best situation. So this is the decision tree that we have come up with. I'm going to now turn it over to my colleague, Dr. Gabby López-Zerón, if you would turn over the controls to this. And Gabby's going to explain this in a little bit more detail and then talk about the key questions and phrases that we mention in this figure here.
Great, thank you, Cris. I'll take this opportunity to introduce myself. My name is Gabriela López-Zerón, and I work at Michigan State University in the Research Consortium in Gender-Based Violence. So I work with Cris on some of the projects that she's talked about in terms of determining what are the services that work best and for whom and in the community when we're working with survivors of gender-based violence. And so to pick up where Cris left off in talking about this decision tree that we are proposing, I just want to reiterate the importance of having those conversations around stability and safety at the beginning. And so first is to assess whether the survivor is stable in their housing and their safety concerns as they relate to housing. So in determining whether housing is stable, then we are providing here two different options. If survivor is in fact stable in their housing, then we're proposing to provide an appropriate amount of support and information and advocacy and continue to assess housing needs. We have added this because we know that, this is not a static thing, that things are in constant movement and that can change, that stability can change. If survivors are not housing stable, then the first question that we're suggesting here is to determine whether survivors and their children are in imminent danger. If they are in imminent danger and must flee, then we're suggesting providing immediate safe housing, and whether that would be a shelter or similar, or perhaps if there is no shelter bed available at the time, so maybe a hotel voucher or something that can help the survivor flee immediately. We're also suggesting that depending on where the survivor is at, to after 24 hours or 72 hours to just transition out of their home and into a safer space, to continue with the housing assessment. So to give a little bit of time so that survivors and their children can adjust to the transition. If the survivor is not in imminent danger, then here's where we're proposing assessing housing needs. So really thinking again about the different options that a survivor might have. Understanding that not always all these options are available. I think it's important for us to continue to have this conversation, that part of the big issue that we're having across the country is that there is more need than there is availability. So not all of these options might be available, but for the sake of illustration here and following this image, on the first column to the left, we have the situation about a survivor who might have the housing be stable, but a one-time crisis jeopardizing housing. So what would that look like? That would be something where the survivor is employed, safe in the home, but the abuser has left and is refusing to pay rent, and she was not counting on that. And so it's having a moment of crisis, or maybe the survivor has employment and has some income, but the abuser slashed all her tires and really doesn't have any way to address that. And we know that if the survivor doesn't have the access to her car, then she might not be able to make it to work. If she doesn't make it to work, then she might not be employed for very long. She might lose that job. And if she loses her job, then she really is going to be housing unstable and might not be able to afford housing. And it can become a little bit of an avalanche. And so if this is the case in those conversations that we're having with survivors, then what might be most appropriate for the survivor and her family is flexible funding and brief housing advocacy to reestablish housing stability. So this is something that a person might need for a short period of time. On the other hand, a survivor might have some more housing barriers that could be addressed with 3 to 6 months of financial and advocacy assistance. And so there might be a person who momentarily lost their job and really needs some support on employment, but feels very confident about being able to get a new job, and it just needs a little bit of support for a few months. And so if that's the case, then perhaps a rapid rehousing program or housing voucher plus advocacy for 3 to 6 months might be most appropriate, or flexible funding so that somebody can stay in their current housing plus the advocacy to address some of these barriers. So perhaps it's somebody who has lost their job, and so they need some advocacy to be able to gain employment or to clear some criminal background that might be recent or something along those lines. Sometimes for survivors, housing barriers are far more complex, and it would likely take 6 to 24 months of financial and advocacy assistance. So this might be a survivor who is an immigrant who doesn't have employment and doesn't have a credit record, and so it might be very hard for them to rent. Might be somebody who also has a criminal record in their background that they would need to have it be expunged. So there might be a lot of different things happening for this person that would be complex and would need to be addressed so that they can obtain housing stability. So this would require some longer financial housing support or a housing voucher, plus the added advocacy services. Or if there is a possibility for this, then this person might be a really good candidate for transitional supportive housing. And that might be something that they prefer so that they could really get more stable during this more extended period of time. Finally, we have survivors who we know need a lot of services. So housing barriers are significant, and they likely might require more than 24 months of assistance, not only financial assistance, but also advocacy assistance. So a survivor who has this, a lot of multiple and complex housing barriers might be better suited for permanent supportive housing or a housing voucher, or transitional supportive housing with a fair amount of advocacy services once they're stably housed. So the initial transitional housing period, but then also at the back end of that, having advocacy services also added to that. So this image here is to kind of guide us as we think about all the different possibilities, as we know that what is best is to make these decisions with survivors. And so to have conversations about what are the things that they might need to figure out next steps in terms of obtaining that housing stability. And we also acknowledge that having these brief but focused conversations do require a fair amount of skill on the part of the service provider. And so we here have some key questions and phrases that might help accurately and effectively assess the needs through these targeted conversations that really do require providers to have strong communication skills. And so these are some of the skills. This is not meant to be absolutely comprehensive, but some suggestions about what the skills that providers might need to have be able to have these effective conversations. So for active listening is having these conversations with survivors in which we're able to really make sure that we're understanding what people are saying. So a lot of the times using phrases like what I'm hearing you say to reflect back to survivors might be helpful, not only on our end if we're having conversations with survivors about this, but also for them to make sure that the provider is really understanding what is it that they're needing. So these are all key phrases that might help reflect back that information and also let the survivor know that the provider is really understanding what the person is saying and what their priorities are. And this not only is important to make sure that we're being effective communicators and really understanding what the person might need, but also it lets the survivor know that the provider is really paying attention and wanting to understand and hearing them out, which creates trust. And that's also important because in these conversations, other things might arise that haven't yet in terms of what are some of the barriers or things that are in their background that really might be preventing them from accessing housing and maintaining their housing. So in these conversations, other things might come up as well. And so also it's important, again, to really open up the space when providers are having conversations with survivors to have them express themselves openly. And so in that, to be able to offer just some validation about the experiences that the survivor might be having would be very important. So phrases like, I'm sorry that this is happening to you. I know that this is extremely difficult for you. Or saying something a little bit more elaborate, for instance, you know, we know that everybody is different and everybody has different issues and concerns. Some people have criminal records, or some people are dealing with drugs or alcohol, or have family issues that might impact their safety and housing. And I'd like you to feel that you're able to talk to me about what's going on for you. I'm absolutely committed to help you get safely and stably housed. So in these different ways of phrasing this, it really depends on what our personal styles are in the way that we communicate, but part of it is demonstrating empathy and opening up the space so that survivors can share all the different things that they might be struggling with that might really be preventing them from obtaining safe and stable housing or maintaining it. Another important skill that we thought it was key for us to highlight is that sometimes we might need to redirect the conversation. And that is done when a survivor might really need to talk about things that are not related to, that are important to them, but might not be related to helping them obtain and maintain housing. And so being tactful in that conversation is, if this is something that you've already talked about, that you can feel that the person might need just a little bit of guidance through the conversation to say something like, I know that this is a really important concern of yours, and I'd like to come back to it, but right now I'd like to make sure we're focused on getting you into housing. Is it okay if we go back to this? And so maybe the person has been talking about some issues and concerns that she's having with her sister, and something that might not be directly related on her being able to obtain housing, but you know that we really need to get her into housing or into some sort of stability because for whatever reason she needs to move into either a hotel or shelter or something like that, and you're trying to figure out what the best fit would be. This would be a good way to phrase that. Also, it could be if it's something that you've already heard multiple times, to just acknowledge the comment and ask for permission in a way to change and redirect the conversation by saying like, oh, okay, is it okay if I now ask you about whatever thing around housing you needed to ask? As we've already mentioned today, it's really key to be able to make these decisions together with survivors. We know that that is just the best way of going about it. And so sharing the options that might be there and, you know, acknowledging that not always all of these different options are available. And so being pretty frank about that is also important and something that we're trying to propose here. So say, let me tell you about the different options we may have to choose from, and then we can figure out together what might be best. And then you can go into the different options. And sometimes somebody might really want a particular option that's not available. So, you know, we can talk about how to address that. But especially at the beginning when you're assessing whether somebody is safe to stay in their own home, to say many people assume that they have to leave their homes in order to be safe, but we may be able to help you pay for some things that would allow you to stay in your home if you'd like to consider that. In those conversations, then it is a really good time to really assess safety concerns as related to housing, because we know that this is true for some individuals. There are instances where survivors could stay in their own homes if certain precautions were put into place. So if the abuser is no longer there, has moved, no longer presents a threat, then putting some security cameras or having the locks changed, that could help a person and a survivor's family stay in their own home safely. And then negotiating some options. As I just mentioned, not all housing options might be available. So to really be honest and have a conversation with survivors about that. For instance, I really wish we had a housing voucher to give you, but since we don't, what do you think about these different options? What are your concerns about them, to be able to make decisions together as to what would be the best option for this particular survivor? What if the shelter is full? So the shelter is full right now, but I'm able to locate a hotel voucher. Do you think that would be a good immediate option for right now? Or do you have a family member or friend that would be a better option for you? Let's discuss what are some things that we could do, especially if there's some imminent danger and the survivor needs to leave their home right away. So those are some of our suggested language about this. Again, this is not meant to be exhaustive, but just framing some of the conversations that we are suggesting might be really important to have to determine what is to determine what the best options for housing for survivors might be. I can see that there's a lot of questions on the chat. So yeah, Kathy, if you want to.
Yes, I'm happy to chime in. Thanks, Gabby, and thanks, Chris. That was really some helpful information, and I'm glad we're having such rich conversations in the chat. I'm going to invite Heidi. I think you wanted to say something before I dive into the questions.
Thank you so much, Kathy, and thanks to everyone for your comments, your questions. I see a lot of energy around this topic, and it gives me a lot of hope, and I feel, I would say, mindfully excited right now about the possibilities. I just wanted to say, just based on what I've seen so far, and excellent points that many of you have made, as always, this is an approach that doesn't have all the answers to every single thing. So I think we're asking you all in your specific communities to, as those that know your context best, to actually utilize this framework as opposed to a scoring tool, and see where that takes you. We're not saying that this is a fixed recipe for everyone to utilize exactly as a checklist, right? So I think we're wanting communities to move away from that approach and try something different. Try to assess needs based on understanding the entire context that could surround a survivor's life and experience around violence. There was a great point made by Linda Olsen about what can the consortium do in terms of making this approach widely utilized and that sort of thing. I would say that we understand that there's going to be some necessary technical assistance following this, and many of you have tons of questions, and you're going to have questions around implementation possibly, to please reach out to us. And I also would like to highlight, as Cris said earlier, that HUD wasn't requiring everyone to utilize the VI-SPDAT. That was what happened because there was nothing else. So this is an invitation to try something different, as we said earlier. So those are my points that I just wanted to highlight here. Please reach out. We're going to continue to present other facts around trying something different in a mindful and intentional way. We understand that what we're asking is a shift in practice that could have tremendous implications for many communities. So we want to do this intentionally and responsibly. Kathy.
Great. So thank you, Heidi, for reminding everybody about that. I am going to try to tackle several of your questions, and I'll start at the top, and if I can, I'll try to merge a few of them together as I hear them. But to begin with, one of the early questions for Cris and Gabby are wondering if there are any COCs that are allowing this in place of a scoring system, and what's a sense of how acceptable will this scoring tree, will this decision tree be as a method for prioritizing? Trying to get at how receptive you envision, or how receptive you think COCs will be.
Well, that's certainly the most important question. And one of the most important questions out there, isn't it, is this something that people would adopt? So, you know, as we've said, HUD is actually open. They want a tool. They want to make sure that you are using a tool and not just being subjective, which I think is fair. I will say that when we went down this road, we brought in the federal partners who were funding this project. So we brought in a federal partner from HUD, as well as from the FIPSA office, as well as from DOJ, to say, this is where we're going with this, and we don't want to waste our time coming up with something that then is going to get shut down. And we were basically told that, no, there was interest in this. Now, having said that, I am not positive that our contacts at HUD have seen this final paper. So I am not going to endorse it on anyone's behalf at HUD. I don't think they are on this call, but it's something that we will need to go back with them. But I will say that there was interest and there was support in going down this road, and in the initial ideas around this paper and this decision tree. So I think it is important, you know, as far as will COCs do it, you know, it's a political question in some ways, because we have to be fighting for what is right. We've got COCs around the country saying that it's mandated to use the VI-SPDAT when it is not. We have different COCs saying other things that are not true, which we know. So we just have to make sure that we have the information with us and stand up for these things and push for what's going to make the most sense. You know, as Heidi said, this is not being presented as the be all and end all. It hasn't been piloted yet in this exact way. I will say, I did not come up with this just out of my own mind. This is something that I created and Gabby helped with based on lots of conversations with people around the country for a number of years. And I know that some agencies are already doing something like this. They just hadn't written it down. So we really were trying to come up with something that was bringing up the best from the field, and what people were saying is already working fairly well. But it's a process.
Thank you. And yeah, this is Kathy again, just to contextualize this. This is just the start of rolling out a series of suggestions and guidance and framework, and to recognize we're talking about systems change here, whether we're talking about it on a national level or state level or in local communities, and we all have a role to play in that kind of systems change. So thank you for that. I'm going to move on to another question, and this is around instances where survivors are being assessed for mainstream housing services, not necessarily DV specific services. So do you have a sense of how this this decision tree could be utilized in those kind of scenarios?
Yeah, another great question. I've been so busy having such fun watching these chats going on to stay really focused. I really appreciate how much people are chatting with each other, because again, we don't have all the answers. This was a forum for us to facilitate lots of brilliant minds. Mm-hmm. I'm happy to get started on that question, which was, and I've seen other questions about this in the chat, was this clearly just created for domestic violence survivors? Mm-hmm. Well, this is a project of the DV TAC, so, you know, which is focused on domestic and sexual violence and housing. So this particular paper and tool is about assessing housing needs for domestic violence survivors. But as we've been doing it, we keep talking about similarities and differences across different homeless populations and how this could be modified. We didn't want to go any further without bringing it to all of you and getting feedback on, is there even an openness to this type of a thing? Is this something that would be useful? And getting back to Kathy's issue about this being a political issue as well, I would love to hear what people think about this, but I really think it's problematic that we have one pot of money that we're supposed to use to prioritize people from such very different situations. So, you know, veterans, domestic violence survivors, runaway youth, chronically homeless. Why is there one pot of money where you're trying to decide which of those people is more deserving of that one unit that's open? We know that when the federal government years ago decided to end veteran homelessness, they put a lot of money into ending veteran homelessness, and they had vouchers and a system of prioritization that was just for veterans. I tend to think that we need to do that across a lot of these groups so that you're not comparing a veteran with a sexual assault survivor or a runaway youth with a chronically homeless person. I think we need different pots of money because some of these questions are specific to different populations. I have no idea if that's a reasonable request, if that might be something that happens in 2021. But that strikes me as something that would make a lot more sense. But right now, to answer the question, this decision tree was really focused on understanding housing needs of domestic violence and sexual assault survivors. That may or may not be useful to COCs that are trying to come up with one tool for everybody, but I'd love to open it up and see what other people have to say.
Great. Yeah, we're all trying to engage in a dialogue, and there's over 100 of us on this webinar. So I think, you know, we're putting Cris and Gabby on the spot to try to respond. I won't even say answer questions, but respond to questions. And it's lovely to see people also responding to one another in the chat. So let's keep going just to see where the conversation goes. There are a number of questions that are still trying to kind of wrap their heads around scoring and the VI-SPDAT scoring, and how might the decision tree model be translated or used with VI-SPDAT scoring. And I think you spoke to this, but I want to give you another chance to kind of address that a little bit more directly, because it's come up a few more times.
Yeah, I just don't think you can put a number on somebody's experience that will then tell you what housing option makes sense for them based on that one number. And I think anyone who's been trying to do that would agree, but certainly jump in with a chat if you disagree with that. So and this is why we brought up also the first come, first serve, is there are wait lists. You know, I wish there weren't. There are, whether you're using a scoring tool or this tool. In a lot of communities, there's still going to be a wait list. But when you're trying to figure out who gets the next rapid rehousing money that we have available, who gets the shelter bed, who gets the transitional housing opening, these are the kinds of questions that at least can help us make sure we're not putting somebody where they don't need to be, right? I can tell you from doing this work for a long time, we have a lot of people in domestic violence shelters who do not need to be there. And anyone I know who works in a DV program will tell you that they're there because there isn't other housing available to them. They're not there because their safety issues mean they have to be there anymore. It's just there isn't anywhere for them to go. That's extremely expensive, and no one wants to be in a shelter if they don't need to be in a shelter. And if those people are in a shelter who don't need to be, but they're there because there's nowhere safe to send them and the shelter staff don't want to put them out on the street, then that means we have people in our communities who desperately do need that shelter bed. They are in immediate danger right now. So, you know, we have to be doing something that is trying to help figure out, you know, especially if somebody is still housed, you know, we talk about homeless, but when we're talking about domestic violence survivors, you've got the fleeing domestic violence, they may have a home. And in a lot of communities, especially very expensive communities, like just about all of California, Washington, DC, areas that may have rent control, but you do not want that person to lose their housing if there is any way to help them keep that housing. And they may just not know that you can help them. This comes down to resources. I did see a couple of people in the chat say, what is this about flexible funding? I've never heard of this. We don't have this. And that's a problem, because we are finding, and research is showing, that if you have a pot of money, we call it flexible funding, a pot of money that you can use in whatever way a survivor needs, that can actually prevent homelessness. So it might mean that the person needs new tires on their truck. It might mean that they need to update their licensing for the type of job that they have. These things may only cost a couple $100, but if we don't have that flexible funding to give people to take care of that immediate need, they will lose their jobs, they will lose their housing, and now all of a sudden they're in a very expensive crisis. So it's really cost effective for communities to have this flexible funding. And we think that that really needs to come from the private sector. There are some organizations that have a combination of public and private. Some of your public funding allows for some level of flexible funding. I tend to call that semi-flexible, because they're not going to let you spend it on the kinds of things that private funding will. So that's a whole nother conversation, and there are resources and information on the Safe Housing Partnerships website on flexible funding. But it's an example of resources that need to be available in our communities to prevent homelessness, to prevent things from becoming even more dire and more expensive, and to make sure that we've got a variety of options available for people.
Great. Thanks for that plug around resources that are at the Safe Housing Partnerships website. We do have quite a bit of information on flexible funding, and we can follow up with folks about that if you're curious. Here's a different question for Gabby and Cris. Someone is curious, or a couple of folks are curious about how this model addresses obstacles that come through lack of immigration status or complex challenges that come through human trafficking. How might some of those challenges relate to and impact a conversation and a decision tree around housing?
I'm just waiting to see if Gabby wants to jump in on any of it. Gabby, did you?
Yes, I was finding the unmute button. No, these are great questions, and I think when let's talk about the immigration challenges that might influence conversations around this. I think it's really important to understand what those challenges are, especially in the current context in which everything around immigration services is taking so long. So that really needs to be something that providers need to have a clear understanding, because it might mean that that particular survivor, especially immigrant survivor or survivor of human trafficking, might need one of those longer options for services to really be able to obtain housing and then maintain that stability. So I'd say that for the most part, if somebody is undocumented and is working towards documentation, then it really would require some additional support and time and understand what the circumstances are. And so then this decision tree and the conversations might probably lean you to consider the far to on the right options in terms of some longer term support might be needed.
Okay. This might be, well, this is a several part question. So there's some folks who are curious about consistency and compliance and making sure that folks who are doing this series of conversations, housing conversations, and using this decision tree are doing it in a way that is ensuring fairness. Are there thoughts or guidance around that?
I don't think I have anything additional to add to that, other than it is very important. And I think depending on your community and who you're working with and what resources are available in the community, that all needs to be modified within this decision tree to help make sure that this just doesn't become a way to be completely subjective about who gets what. Like, it needs to be documented what you asked, what people said, and then why there was a match toward a particular resource.
Great. Yeah, I think you did a really nice job outlining earlier why the VI-SPDAT has been popular, in the sense that there's a perception of objectivity to it. And so I think it's been helpful to point out the ways that it isn't even objective and unbiased, and that this process is an alternative to that. So somebody else in the same kind of vein asked about the potential for racial bias in how the decision tree might be implemented. What thoughts might you have about where there might be potential for that, and how you might mitigate against it?
Yeah, I mean, there's always that risk with anything that we're doing, right? And we know how common it is. So I think, again, the more that we're documenting, possibly even having teams of people making these decisions. I also think that it's important that the staff of agencies and COCs are representative of their communities, because that alone, regardless of what tool you're using, can minimize the risk of racism coming into play. We know that so many people in the housing world are white people, and that's going to continue to be a problem because we know, of implicit bias. So those are the kinds of sort of immediate things that I would think. can help us, but it's something we always need to be safeguarding against and being watchful of. And I think having teams of people and watch guards on that, regardless of what we're doing, is important.
Thank you. I think I've been trying to capture all the questions and blend similar ones together, and I feel like we've covered most of the territory you all have been bringing up. So if there are some final questions, as you can imagine, it's a little hard to track everything, and it's coming in fast and furious. So if you have any remaining questions, I would invite you to add those, and I'm going to open it up to see if Heidi and Gabby and Chris and Brittany want to add anything else to this conversation right now.
I just want to, this is Chris, and while I believe you're now going to hear about some of the other papers that are coming out and a little bit more about this series, while that's happening, if you have ideas for next steps, that would be incredibly helpful for us. I mean, if you think that there is promise in this tool, but could say, here's what I would need from you next for this to be useful, please jump in and provide that information for us.
Okay. Yeah, there's one recent question here that just came in around how this kind of conversation would be documented with an HMIS data system. I don't know that you all have immediate thoughts on that, but again, we can track that question along with all the rest of these to try to provide some more ongoing resources. Do you have any immediate thoughts on how this would translate to HMIS? Homeless Management Information Systems, I should say. That'd be it. We'll get back to you on that question. So thank you all. Again, we really appreciate all the dialogue that's been happening both with Chris and Gabby and Heidi, but as well as in the chat box. We know several of you requested some follow-up and had great ideas about additional resources, ongoing conversations, more webinars. Yes, several of us who are involved with the consortium are participating in this call and tracking questions, and we will debrief and see what sorts of next steps we can pull together to give you some resources and information that's responsive to these questions. Give you a sense of what's coming. I'm scrolling through my list. We have another paper that will be, it's actually on our website right now, safehousingpartnerships.org, and we'll be putting together some follow-up resources around that. And I think Chris alluded to it. That paper is called Assessing Vulnerability and Prioritizing Risk, the Limitations of the VI-SPDAT for Survivors of Domestic and Sexual Violence. And our hope with that paper and with other papers is that you all can be taking these to your communities, to your COCs, to your housing partners and so on, and being equipped with the tools and the information, I think, as Chris said, to be a strong advocate. So that is another paper that's available. We'll be having a podcast to talk through some of that content. And so stay tuned. Again, I would encourage you to keep your eyes on the safehousingpartnerships.org website. And also, if you go to that website and you scroll down to the bottom, you'll see information about our newsletter. And I think a few people have already indicated in the chat box they want to get added to that. So you can click on a link there and make sure that you get subscribed to our newsletter, which will be coming out again. And you'll continue to hear more about additional resources. Some of the next papers coming down a little down the pike. One is around the pitfalls of prioritization, and really thinking about the power and culture that's involved around how we prioritize. Again, I think Chris and Gabby alluded to some of these hard prioritization challenges where we're pitting some really compelling stories and competing kind of vulnerabilities together, and how problematic that is, and how it can be biased and when power and control and culture is involved. We'll be having another paper that speaks to the importance of a real robust constellation of housing options for survivors. Again, Chris teed this up a little bit by acknowledging there just aren't enough housing resources in our communities, right? And so we need to keep advocating for the supply of safe, affordable housing to be increasing. And then another paper that we're looking at is around understanding the cycle of housing insecurity for survivors of domestic and sexual violence who are marginalized. And there's some really exciting research there that's been community-based participatory sort of research, hearing directly from survivors who have experienced some forms of oppression and what that housing insecurity looks like for them as well. So that's some of what we're teeing up, but to really echo what Heidi had indicated, we're starting to roll this out, and we do expect this to be a bit of an iterative process. And so we're going to continue listening to you all in the field. We're going to continue to adjust and adapt the resources and the recommendations and the policy advocacy that we're doing based on what you're telling us, what you're experiencing. I think something that came through loud and clear in the chat is the sense of, okay, we like this, and how do we implement it? How do we convince our partners and our COCs to do this? And in many cases, I also want to acknowledge some of the COCs are really right there with us. We certainly know that many COC folks are indicating that they're dissatisfied with the VI-SPDAT and they're looking for alternatives. So we're hearing from some communities that have started down this path in different ways, and we want to make sure that we're lifting them up and making them accessible to all of you. So as we proceed in the coming months, we'll be putting together subsequent webinars so that you can hear from and dialogue with folks who are trying some alternative and novel sort of approaches around coordinated entry and prioritization in their communities. So please stay tuned. If you are doing some of this work and you're starting to apply some of this in your communities, let us know, be in touch with us and communicate. Because we want to make sure that we're really spreading the knowledge and the innovation and helping people to learn from one another. You see on the screen we have Cris and Gabby's contact information, and I have not been able to keep up with the chat in the last few minutes. Is there anything else that I'm missing? I'm asking my partners.
No, I think you're good, Kathy. I think you're good. I think folks keep asking whether you're going to get a copy of this, a recording. You will. We will share the recording of this presentation and the accompanying materials with everyone.
Excellent.
And I think I would just let for all of the folks know who are curious and who want to know more, there's a ton of information on the Safe Housing Partnerships website, not only on this conversation around coordinated entry and how to do this, equitably, but there's also a ton of information on the intersections that a lot of folks surfaced in terms of racial equity, immigration, so on and so forth.
And one last point I would like to make, this is Heidi again. Some of you ask us, could we advocate for the use of this framework? And I would say you have our word that we would do our part, but we need you in this as well. So those of you that are ready to start implementing, that would need a follow-up technical assistance, please reach out. As Brittany posted there, you can reach out to us through the Safe Housing Partnerships website, and we'll continue this dialogue. Thanks again.
And with that, I guess we'll wrap early and give everybody an extra 11 minutes to your day. Go breathe, be outside, pause, and thank you again.